Now that we've had the radiology and the pathology, we're going to move to the clinical side. And our next speaker is Dr. Wesselius. Lewis is a colleague of mine and a tremendous resource over the last 15 years or so, especially with IPF and interstitial lung disease. So really looking forward to his talk, trying to give us an update on idiopathic pulmonary fibrosis. Lewis?
All right, thanks, Vij. Let me pull up, let's see here. Okay, just a couple of disclosures I should make. One, having been a PI on some of the clinical trials on drugs relevant to IPF, and did participate in an advisory board for Boehringer Ingelheim. And before I get too far in, I would say that probably my best advice, as a clinician taking care of patients with IPF is to try to work with a radiologist as knowledgeable as Mike Gotway and a pathologist as knowledgeable as Henry Tazalar, because this really is a team approach, and the better the radiology help you have, the better the pathologist. It'll make your job a lot easier. I know that's not always readily available, but it makes a big difference if you've got a team. This is sort of a classification system going through the specific causes of diffuse parenchymal lung disease, what we still frequently call it interstitial lung disease. And I usually it's a lot to go over with teaching with residents, fellows, but you can break it down into 4 groups. The ILDs of known cause, including drug, connective tissue disease, hypersensitivity pneumonitis, although as Henry was mentioning, we only know the etiology of HP in about half the cases. There's also granulomatous ILD, which is almost always sarcoid. There's some sort of unusual forms of disease. They're classified here, although I think it's really more parenchymal lung disease. Right? They're not typically completely interstitial. That would include LAM, for example, or pulmonary Langerhans cell histiocytosis. But then we're left with this big group of idiopathic interstitial pneumonias, and those are typically broken down into what we would call the major groups. And in that group, IPF is the largest at about perhaps 40 or 50% of all cases. You have some rare forms of interstitial pneumonia. LIP is probably not rare, but it's usually going to be more associated with autoimmune disorders or Sjogren's syndrome. This is a sort of a newer described, fairly rare entity that can cause interstitial fibrosis. But in this group over here, most of these will have significantly different radiologic features.